Welcome to the Darcy Wellness Series. During our series, we will be presenting information on complementary and alternative medicine and how it can benefit you, your health, and your loved ones. In the Darcy Wellness Series of shows, we'll cover complementary and alternative medicines such as acupuncture, qigong, herbal medicine, massage, chiropractic, whole foods, natural foods, integrative medicine, vitamins, and chelation. Today we're going to talk about complementary and alternative medicine as an overview to our series and why is it so popular. My name is Geoff Darcy and I'm an acupuncturist and herbalist, and with me in the studio are two very experienced acupuncturists and chiropractors. We have Betty Wu, who's a licensed acupuncturist, Hi. And Wendy Kagan, who is a doctor of chiropractic. And we're going to be talking about complementary medicine, and we'll kick off with Betty. So what is alternative medicine, Betty?
Alternative medicine describes therapy that is used in place of conventional medical treatment.
Right. So you can use complementary medicines with or without, and alternative is usually used by itself.
Just by itself, correct.
Right. And Wendy, how about complementary medicine?
Complementary medicine is non-pharmaceutical and non-invasive medicine that's used along with medical treatment, allopathic medicine.
Right. So basically then complementary medicine complements the conventional medicine. So if someone with cancer was having chemotherapy, had nausea, or wanted to seek some treatment for their nausea that was alternative, they would continue on their treatment plan and do the alternative treatment. Right. Complementary treatment. So, Betty, tell us, generally in our society we tend to think of alternative as something very new, but traditional Chinese medicine has been for thousands of years and it's been used a long time there. It's not new there. Acupuncture, herbal medicine.
Right.
How long has it been used?
Oh, gosh, could be 2,000 to 4,000 years old, depending on what text you're looking at. About 750 million people rely on this particular traditional Chinese medicine, acupuncture, herbal medicine, and qigong. Within that three categories, 60% of that is comprised their healthcare system.
Right. So people in the West don't realize that first it's not new. It's been around for thousands of years, but 60% of the Chinese population is relying on it for their health care.
Correct.
Yeah, so that's herbal medicine, acupuncture, and qigong. So in the, generally speaking, when would you think about using chiropractic? When would be a good idea to use chiropractic care?
Anybody that has a spine really should be checked by a chiropractor, because a subluxation, which is what chiropractors treat, can only be recognized and diagnosed by a chiropractor. It's unusual for somebody other than a chiropractor to be able to recognize exactly what a misaligned spine is.
And the idea of treating the root versus just palliating the symptom is finding the root cause, what's the cause of the pain, versus just taking a non-steroidal anti-inflammatory to kind of mask it.
It's true. We've grown up, unfortunately, here just masking symptoms rather than really addressing the cause.
Right.
And chiropractic aims to address the cause, to bring the body back toward balance, to its potential in health. Yeah, yeah.
So why don't we cover acupuncture first, and we'll just pick through some of the complementary therapies we'll be covering during the series. And in acupuncture, there are over 8 million treatments been provided in America, acupuncture treatments. So it's pretty wide-ranging these days, Betty, you'd say, all across the country that people are utilizing acupuncture?
Oh, absolutely. Most of the time, if they're informed of acupuncture, they will choose acupuncture before surgery or drugs.
Right.
So people who walk through our office tend to try acupuncture first.
Yeah. What are some of the things that recently that you've treated in our clinic?
Well, there's this one case. A 91-year-old man came in with swollen hands.
Yeah.
And the opinion was to have surgery, which he didn't want. So for carpal tunnel, we use acupuncture, and within 2 treatments, the swelling came down and the pins and needles were gone. He felt much better. So, you know, 80% success rate at second treatment, that made him feel great, and the stress level goes down.
Yeah, yeah.
And
that's a big deal to quality of life too,
Yeah,
because I know
absolutely.
I've had patients with carpal tunnel, and actually one I can think of was had to have 6 weeks off her work just because it was a double surgery and she was unable to do her work, and after several treatments didn't. So that's a case of using acupuncture as an alternative to surgery.
Right, right.
In fact, a case in point, there was a Canadian study where they had 1,000 people go through acupuncture, chiropractic, before they would try surgery for different problems, and they found that 33% responded to the acupuncture and didn't need surgery. And the other, with chiropractic, 33 also responded, 33%. So in total, only 1/3 went on to the surgery. They were filtered out through acupuncture not needing it and through chiropractic not needing it. And I think it pretty much to say that's where we are as a group, where you would try a natural therapy rather than before something invasive or something pharmaceutical.
Right, because it's always there. Surgery is always there.
Right, right. In trying something non-invasive first is huge for quality of life.
Absolutely, yeah.
And huge for lack of side effects and safety and comfort.
And how about for you as a chiropractor? What kind of concrete example that you've treated recently that's helped someone out?
There's a patient I had that came in with a diagnosis of sciatica, which is, you know, a common diagnosis for people to come in and see a chiropractor, back pain radiating down the leg. And what she didn't tell me is that she was having trouble with some of her systems, and she wasn't menstruating regularly and wasn't able to get pregnant. And under chiropractic care, after 2 adjustments, her back pain did go away, but the other bonus was her body started functioning more normally, and she began having regular periods, and she was able to then get pregnant.
So how would you account for that? Is there something in the nerve supply that enabled blood flow? And
it is. It's a combination of blood flow, nerve supply. The whole body is controlled by the brain and the nervous system. So when there is nervous interference, the body does not work as well as it's supposed to. And when you remove the interference, the body is able to function properly. Yeah.
So if we could go to our complementary and alternative medical slide, we're constantly asked how popular is complementary and alternative medicine in the U.S. Now remember that this really combines acupuncture, chiropractic, holistic medicine in general, massage, and so the figures actually show that 1 in 3 Americans are utilizing complementary medicine in some form or another. That's 1 in 3. That's a phenomenal growth in a short period of time, and that these figures were out from 2002, and that there's been an increase, a 50% increase in the use of herbal supplements since then, and also nearly a 2% increase in yoga. So those are some of the growth areas. And if we could go to our acupuncture slide, this is really showing that as part of acupuncture's growth, that in total 8.2 million U.S. adults have used acupuncture in the U.S. in total, and that 2.1 million U.S. adults have used acupuncture in the previous year. So there's a phenomenal growth. Why, Betty, do you think acupuncture is growing? I personally think it's because of word of mouth. There's so many side effects to drugs and surgeries that it's word of mouth that people are hearing about it. What do you think?
Well, it grows because we're taking care of one person, in my opinion, then the whole family comes.
Yeah.
When one family member is challenged with a disease, once they feel better, everybody else also wants to feel better. So then so word of mouth, yes. But at the same time, in my practice, doctors are referring.
Yes.
They are opening up to acupuncture. They are seeing the results in their patients. So, and we do as well. And I think that's a big plus in terms of, you know, they're feeling better, they're spreading the words, education like this kind of forum, and again, the physicians out there.
Yeah, and you know, some interesting figures are that there are, I've just read recently, there are 8,000 US acupuncturists, there are 50,000 in Japan and 250,000 in China. So it may be new here, but it's been very well established in the healthcare systems around the world, and is really being brought into the fore. If we could go to our other acupuncture slide. This one, you know, shows some of the conditions. These are just only some of the conditions that acupuncture is used for based on the NIH, the National Institute of Health consensus report. So, you know, some of the conditions, for instance, post-operative dental pain. Personally, in my practice, you know, over the last 24 years, I found that post-operative pain full stop, it's pretty remarkable for. That nerves grow, I believe it's something like, if it's been cut during surgery, at 1 inch per month, which is, can be considerably increased with the use of acupuncture. So how about some of the other ones? Stroke rehabilitation, I'm sure you've dealt with that. Have you dealt with rehabilitating with paralysis from stroke with acupuncture?
Yeah.
There's some good studies out there really showing the benefit of acupuncture for...
Right. The thing with stroke rehab is the sooner they get in after the stroke, the higher the success rate.
Right, right.
So, and the other good thing is once they get the treatment, they can actually feel the movement of lost mobility.
Yeah.
So,
that's quite dramatic too,
right,
when they
right.
start to stop using canes and are able to move around more freely. What are some of the conditions at our clinic, at the Darcy Wellness Clinic, that you find that you see a lot of? I see a lot of, been seeing a lot of asthmas recently, a lot of musculoskeletal pain. Some surgeons have been referring, so we've seen a lot of frozen shoulders, a lot of osteoarthritic knees, hip bursters, sciatic problems. What are some of your favorite ones, Betty?
Well, what's coming through a lot is fertility, and what you talked about. A lot of women are struggling in that area because of stress and emotional situations where they will do IUI or infertility treatment combination, which is complementary to acupuncture, and they'll use both because they want to have that baby.
That's right. There was a recent German study I saw on the use of IVF. And IVF with acupuncture, and they found that IVF with acupuncture, there was a 10% increase in the success of the IVF.
Yeah, and when they combine it, the problem is actually joyous because then they have to decide, do I want 2 babies or 3 babies? Right. You know, so that's
a fun area to work in.
Yeah,
If we could go to our video now, this explains a little bit about what we do in our clinic in the clinic setting. So we're just taking out needles from Odemar, who's had a lot of pain from a trauma in his ankle and in his neck. And we're just taking them out of the neck here. From an acupuncture perspective, the neck has had a big traffic jam, a big stagnation in the flow of energy, and what we're trying to do is have that energy initiate biochemical healing. So we've just opened up the meridian flows through his neck and through his ankle. Just going to put massage a little bit of biofreeze in. Just to complete the treatment. And then through the ankle. Back to the Darcy Wellness series, and one of the things we're going to be covering in this series is chiropractic. If we could go to our first chiropractic slide, that would be great. So Wendy, more than 20 million Americans seek chiropractic care each year. That's pretty phenomenal. What kind of conditions are people seeking care for? If we could go to that slide, there we go.
It's very exciting because a lot of people, who aren't educated about chiropractic come in for back pain and neck pain.
Yeah.
And as we were talking about before, since the nervous system controls every function, every organ, every system in your body, there's a myriad of symptoms.
So is it just mainly musculoskeletal pain that you see?
No,
Yeah.
no. A lot of times the common thing was to come in for back pain, but now people are starting to really become more educated about chiropractic.
Right.
And people are coming in because their children have chronic ear infections.
Right.
And along with acupuncture, it's fabulous.
Yeah.
They're able to stay a whole winter off antibiotics.
Yeah, that's pretty phenomenal.
And it's phenomenal because then you don't get into a lot of other problems.
Yeah.
You know, you don't want to just keep pounding these kids with drugs.
Yeah. That's pretty scary, especially, you know, with the use of antibiotics and then the continued, you know, inner ear infections. And
it's unending. And,
Yeah.
you know, ear infections are not caused by a deficiency in antibiotics.
Right.
It's a deficiency in health. It's
Yeah.
the
the vital force.
the
of,
vital
yeah,
force, whatever you want
yeah,
to call
however
it.
You,
So if
yeah.
you can use whatever natural therapies to bring the body back to balance, it's the person, the child, anybody ends up being stronger from the illness if you
Right.
can heal it naturally.
That's great. I
it's
look forward
great.
to hearing more, you know, to showing more to everyone about it in the coming series. If we could go to the video of the chiropractic treatment at the clinic, that would be great.
So we have Laura here in the side posture position. This is typically done for low back adjustments. What we're going to do is we're going to have her just bring her shoulder down forward a little bit. What we're going to do is we're going to kind of push here, brace her leg with my leg, put my hand on her low back, roll her over, and then at this point I would then drop and do an adjustment. What we're going to do now is called an anterior thoracic adjustment. What I'm going to do is I'm going to have him cross his arms. I'm going to put my hand underneath his back. Have him take a nice big breath for me. And the adjustment looks a little bit like that. What we're doing is we're opening up the joints and getting motion back into the joints and, yeah, relaxing the muscles in that region. Go ahead and sit up for me, George. Go ahead and swing your legs that way. Just going to check his neck. And what I want you to do, George, is to come on your side, face me. I'm going to do the side posture adjustment right now. Again, I stabilize his leg. Push here. Take a nice big breath for me, George. Put my hand on his low back, roll him over, and then drop. And then we're going to do the other side. Nice big breath for me, George. Good, just relax. Good. George is a big guy, so it's a little difficult to adjust him, but we manage, and George has been doing very well with the care so far.
Very, very good.
So we're pleased about
Very
that.
good.
Great.
Welcome back. One of the therapies that we're going to be talking about during the Darcy Wellness series is chelation. If we could go to the chelation slide. Chelation therapy is very interesting, was first developed for lead poisoning from paint in the 1930s. And what they found was that the group of lead painters who had heavy metal toxicity would have EDTA, which is a synthetic amino acid, dripped into their veins, and that would start to improve their heart disease and deplaque arteries. It's considered alternative, and you know, Dr. Gertler will be along explaining, he's a medical doctor, explaining chelation therapy in greater depth. We'll be covering other health issues such as food, which is a very controversial issue, and how to use food to lose weight and detoxify. That's in Diet Detox, our Diet Detox program, which will be covering how to use natural food. So Po Harvey, my wife and partner, and Yuan Ling, who's an acupuncturist, herbalist, and registered dietitian, will be talking about the use of natural foods to lose weight. And when we consider that these days 60% of the population in the US is considered obese, and you know, something like 30% of our children are also morbidly obese, it's pretty frightening. So how to eat more healthy foods and real foods, and there we'll be covering some of the information from the Okinawan study, which is a Harvard-based study showing how the Okinawans are eating and how that contributes to 80% less estrogen-receptive cancers and 80% less heart disease in Okinawa versus the US, and food is a large part of that. So we'll be taking a look at diet and detox. We'll also be looking at the phenomenal growth of herbal medicine in the US and worldwide. Currently, 80% of Japanese physicians are using herbal medicine. If we could go to that slide. And herbal medicine is not considered, as we heard earlier, that 60% of the Chinese healthcare system is actually using traditional Chinese herbal medicine for their healthcare, and that physicians also in Europe are using 30 to 40% of German and French physicians are using herbal medicine as part of their practice. Again, it's part of this push to use natural medicines where possible before the use of pharmaceuticals and surgery. The other part of the series will be talking with Patrick Crowley, a bodyworker and massage therapist. If we could go to that slide. Patrick will be telling us about the 40 million massages per year and growing in the US, and that's probably reflecting the amount of stress that we're under as a nation. In the psychotherapy emotional health program, we'll be covering, you know, how talk therapy versus psychiatry and drug therapy. We'll be looking at what is emotional health and some of the pointers or the hygiene of emotional health that we can learn about, and how to produce a relaxation response. We'll be covering mind-body medicine with Eva Celeb, a medical doctor who's director at the Beth Israel Deaconess Mind-Body Clinic. She'll be talking about mind-body medicine. We'll also be covering in the acupuncture, as part of the subsection of the acupuncture one, Qigong therapy. Qigong, if we could go to that slide. How Qigong is used in hospitals in China as part of the traditional Chinese medical system. So all of these kind of, just to wrap up, all of these complementary and alternative therapies really offer us a greater shot at well-being, at prevention, and at handling illness and disease in a less toxic, more ecologically sensitive to the body, not killing off intestinal flora, not masking symptoms, not having to do repeated surgeries because the first one failed, or there was scar tissue trapping nerves, or contusions pressing on nerves. So the side effects of surgery and side effects of drug therapy are really discounted when you choose a natural therapy and natural medicine first. So we really hope to educate you and your loved ones into a greater sense of wellness and what other options you have other than the conventional care. I would like to thank our guests today, Betty Wu, acupuncturist, and Dr. Wendy Kagan, a chiropractor. Thank you very much for coming along and sharing some of your views and input on complementary and alternative medicine. So we look forward to seeing you soon, and follow our series along, and we wish you and your family great wellness. Thank you.